looked a little bit, I snooped into you a little bit, Cheryl, and I think that I was thinking about your background and your story and how you got to be the president of Eczema Australasia. And I think you've got a really unique perspective that in pharmacy, we don't really get a lot. We usually talk to a doctor or a pharmacist or a specialist, but not necessarily a patient. But you're also, I don't know if we could call you an expert. You're not actually a dermatologist, are you?
No, I have no formal training whatsoever.
But you're extremely experienced and well-versed in eczema.
Yes.
And I think that's a great place to start, is if we could, hear about how you got to this position and your story. I think is very unique and very useful to pharmacy because you're a patient as well.
And look, adding to that, we know that for most patients, their first port of call is the pharmacist.
Yep.
So whenever we run events like we have these little pop-up clinics for things like Eczema Awareness Day and Eczema Awareness Week. Of course, we didn't this year, did we? But we will always invite a pharmacist to come along and give their perspective and how they talk to eczema patients and what advice they give them. So it's very important to include pharmacists in the whole process. They're the first port of call when you go to your GP, you get a medication and you go to the pharmacist.
Yep.
So the most important message is that they don't frighten people into not using their medication. And it's still the same scenario 25 years later. Nothing's changed.
So you're talking about, what is it called?
Topical steroids. Yep.
Topical steroidophobia?
Yep.
Yeah, yep.
Now, in Australia, which you're probably aware, they've only just taken out of the training last year, the pharmacist training, use sparingly. That no longer means anything. We don't tell pharmacists to give that advice because it just frightens patients into not using it.
Yep.
So GPs don't explain the role of a topical steroid, and some pharmacists are fantastic and some are terrible. Unfortunately, the pharmacist is often quite good, but if you talk to one of the pharmacy assistants, they often don't know much about it. So, and even talking about other products, yep.
And that's what we're doing. This is going to be month 2 of eczema training that we've been doing with Voister this year. So
wonderful, yeah.
We've we use all information that's been sourced from credible public medicine journals. But obviously, every patient's going to be different. But we are focusing on front of shop. Like the front of shop people, this isn't measured.
Yes.
But we believe that. Well, I believe that front of shop, the folks who work front of shop, the ladies mostly who work front of shop, they are the most frequented health professional in the world because that's not recorded, right? Like you go to a pharmacy, you might talk to somebody front of shop, whether it's for eczema or anything else. You're gonna speak to somebody, and then you might speak to a pharmacist, or you might not. So the people who work front of shop are the most influential people in health, in our opinion, because they're the most frequented health professional. They're the person you're going to see most. So we try and get folks like yourself and take all the information and break it down into little chunk size, 1-minute trainings, so that they can sort of convert that information to their patient.
I couldn't agree with you more, because I'm very impressed when I go into a pharmacy and the assistant actually says to me, I don't know, I'm going to go and ask the pharmacist.
I've never not seen that. Unless you get like a new hire that comes from like a gold mark, or she's like a really good salesperson. She's like, oh yeah, I know what to do. My cousin had that, and blah blah. So that'll happen. But no, I'm always impressed with the folks front of shop. But we got a little bit off track here. How did you get to where you are? What's Cheryl's story?
All right, I was covered in eczema as a baby. I was lucky enough to have an uncle who was a dietitian, and he said, put her on goat's milk, and it basically cleared up overnight.
Wow.
My mother was too embarrassed to take me out of the house, literally.
Wow.
And then my poor father had to go around all the dairy farms in the area and get the fresh goat's milk, because there was no natural health food stores in those days. of course, these days they do say that goat's milk has the same protein as cow's milk. But, when I was young, it was a very common practice. And then my eczema pretty much, I like to say it goes into remission. I don't like to say it, clears up or you grow out of it, because we know that it comes back in later life, and that's exactly what happened to me. I had patches of it all my life, but not severely. Then I had quite a trauma in my life in my late 30s, moved interstate, and it came back with a vengeance. And I had a lot of difficulty in getting it, under management or under control again. And I sourced a lot of different practitioners, natural therapists, you name it, managed to get it. And I started working at that time for this association, which I'm with now, as a volunteer. Just because I went along to my local workplace and they said, oh, there's a support group in your area. So I went along, and that's how I became involved with the Eczema Association.
Excellent. And so I started digging a little bit. Sounds like a lot of the times, or some of the time, that the flare-ups can be triggered emotionally or by emotional stress. And then I went down the rabbit hole of psychodermatology, because I remember from my psychology days about the insular cortex, and how that relates to your skin and emotion, and they're actually really quite integrated. And it makes sense if you think about the evolution of a person, the touch, the feeling of your skin. If you think about a little kid, that's pleasurable to them, and that's where they start to develop real emotions. But then later on in life, you can get these emotional anxieties or wounds, and it can work the other way. It goes backwards to your skin. So.
Well, we know a lot more about eczema these days. So we know that it's not just a physical disease, it is emotional and it is mental as well. So the whole three are combined. So what essentially happens is the eczema flares up. The more you stress about the eczema, the worse it becomes. The worse it becomes, the more you stress about it. So it's like this vicious cycle that you need to find something that works to break, that you can actually get some relief. And we know that if you stop the scratching behavior, the skin will clear up. But telling a child who's itchy not to scratch, you might as well say, don't breathe. So we have to use distraction techniques. And that's where things like psychodermatology are so important, because we teach people tools to stop them scratching. And also, if we can work on just the skin level and use the right products for management, it actually helps them to not be itchy. So if they're not itchy, they don't scratch, and then the eczema clears up. So it's quite a clear path, but it's not that simple.
Okay. And so this week, I'll tell you, give me I'll let you sort of analyze or grade me on what we've taught. We've looked into the research of, now obviously all patients are going to be different. We just focus on methods that aren't going to hurt anybody. So what we've done, go ahead.
Oh, well, what we do know is that for most eczema sufferers, and I'm talking about 90%, not the really severe ones, that it's a chronic disease, what we class as a chronic disease, but there's a lot of sufferers that just get it like seasonally, and it's quite manageable if they follow a clear path. So a clear path is use your topical steroid. That helps reduce inflammation. Now, the problem with that is you go to your GP, they tell you that, then your pharmacist tells you that. To a patient, what does that actually mean? It means that, it reduces inflammation and thereby you won't scratch as much, but they don't explain it like that. And if you don't scratch it as much, you're less likely to get a secondary infection. The problem is, talking about topical steroids reduces inflammation, and most patients are confused. They don't know really what that means. So when we do GP conferences and pharmacist conferences, I always say, explain it this way. Using the topical steroid reduces the inflammation of your skin. That'll help you stop itching. If you're not scratching so much, you won't get a secondary infection. That's why it's important to use it. But it's only part of the process. We know that using household things that are sent for sensitive skin, like washing detergent, cleansers, and also one of the most important steps for treatment is moisturizer. It is a treatment in itself. It's a product and a treatment, and it really is the underline and the underpinning of successful eczema management. But finding one that suits you is the problem.
Right.
So that's where pharmacists are so important. You can go into your pharmacy, you might be able to get a sample of a product. Every eczema sufferer I know has a cupboard full of products that they go don't work. We know these days that there's a lot of things different with eczema sufferers. So, for example, a person with normal skin, their skin might you shed your skin cells every 3 to 4 weeks. Same with eczema patients, but we find that the product they've been using quite successfully for that time, for some reason, it just stops working. So one of the best core pieces of advice is recycle your products. Also with your products, like if you've got a kid that's really hot and itchy, pop the cream in the fridge. It's amazing. You put that cold cream on that itchy skin and it soothes and numbs it straight away. You can even do that with your topical steroids. Right. So with eczema, we know it's not a huge thing you do. It's lots of little things that you get a huge result. So I'm actually working with Global Skin at the moment, and we're trying to do a direct care plan that every country can adopt. And these are the steps you take, right? So I constantly say to people, that they go to their GP, then they go to their pharmacist, they get prescribed a topical steroid, but they don't get a lot of background information about day-to-day management. And unfortunately, because some pharmacists still say use this sparingly and doctors don't explain the role of a topical steroid, people go away and they just won't use it. And we know from GPs that non-compliance is a really big issue. So a lot of people will have a lot more success if they actually just try using it, but there's so much misinformation about, and I know I'm concentrating on topical steroids, but this is what we're really talking about in relation to pharmacists.
Right.
So does that all make sense?
No, totally. We covered that first, was the topical steroidophobia, how I think it affects more than 80% of patients where they see it as, they confuse it with anabolic steroids or the governor of California and bodybuilding. And so they're scared of it. And, probably should be scared of the anabolic steroids, but this is a totally different thing.
Well, people just get them confused. And that's why every year we put out a magazine every 3 months. And that's why every year we will have at least a couple of pieces dedicated to this issue, because this is really the biggest issue. The follow-up advice from pharmacists and doctors is really important as well. But if they don't actually get that treatment going, they're not going to have a lot of success. Unfortunately, just moisturising is usually not enough, although we do say that it is a mainstay, but it's in conjunction with your whatever treatment you've been prescribed as well. So, with eczema, it's not just one thing you do. As I said, it's lots of little things that you get a really good result. Another thing too is you get these mums and they have these lovely little babies and they're covered in this awful rash and everybody gives them advice. And, I often say to these mums, the first thing I say is, you've done a great job. Your baby hasn't been hospitalised with an infection, so you're managing it really well. We just need to tweak a few things. And you can feel their stress levels going, like this. And we do know too, there's evidence that taking probiotics from 7 months of pregnancy and then continuing to take probiotics when you have the baby and you're breastfeeding, there's really good evidence that it does help that immune system to fight off infection. And that's another thing that pharmacists should really be talking about as well. Some of the things that go hand in hand with good management.
Any particular strains of probiotics? We've been focusing on...
There was one trial done at a very big hospital in Western Australia, and it's the Inner Health Plus Eczema one, and that's the only one we recommend.
Okay, all right.
So
we did IBS because that's got the Lactobacillus plantarum, but they both do. They both got the same.
They do, but this is This is a particular strain that they developed, and they've got really good, they've done really good clinical studies showing that up to 2 years old, it can make a difference. It's not going to get rid of your eczema, but it's going to help you to prevent getting an infection. And that's what it's all about, preventing infection. Bleach baths have made a resurgence. So bleach baths are wonderful for kids that get a lot of eczema, but then they're no good if you're managing the eczema quite well and it's not infected. They're really of no value. So there's a bit of confusion about some of the treatments currently, being talked about.
Oh, well, I feel good about that. So far, our short-term treatment is wet, for relieving the pain is the cold towels and the aloe vera.
Yes.
Long-term is the moisturizer with the emollients and the what's the other word? Come on, help me out. Anyway, the moisturizer. The prevention, we looked into the, I might be switching those up, but we got the long term was either kimchi, the Lactobacillus plantarum kimchi, or what is it, Indonesian buffalo milk, or the probiotics that you were talking about. And then this week we're going into the bleach baths and the, what was the other one you just mentioned? The bleach bath.
The probiotics.
We're going into like the different mechanisms of the moisturizer, where it's not only it's there for smooth and making the skin more supple, but also for providing a layer of protection so that the nasty's not getting in and the water doesn't get out.
Yeah, and I mean, it's very important too. Most GPs and dermatologists will prescribe ointments, right? Ointments are better, they're longer lasting. But if you have a child that's really hot and itchy and you put a very thick ointment on, they often end up scratching it off. Yeah. So I say to people every day, take your prescription down to the pharmacist and say, look, this ointment, he needs to use it, but it's making him itchy. Can we get it in a cream formulation? And also changing your moisturizers seasonally is very important. Changing to an ointment in the winter and then back to a cream in the summer when it's hotter. And also the creams, the other benefit is you can put the creams in the fridge, whereas you can't do that with the ointments. So that's very important. If you've got a hot, itchy kid sitting in front of the TV, scratching themselves to bits, you've got to make it a game. You've got to get a pot of cream out for you and one for the child out of the fridge, and you have a game. Let's see who can put it on quicker, With kids, the parents are always coming at them to do stuff and they get quite upset. The more upset they get, the more that impacts on their eczema. Yeah. So you've got to be clever as a parent, to sort of get that process going.
Yeah.
We want good management. We want kids to sleep.
I'm the parent that gets upset when they don't listen, and I just use the grumpy.
And that's what I say to that's what I say to parents of babies. If you're getting stressed about it, that flows through to the baby.
Yeah.
And kids are very smart and cunning. I'm sorry to say this, but if they know it upsets the parent, they will use it, to their advantage.
Right.
So that's why you've got to take a step back, make it a matter-of-fact thing, and make it a bit of a game. Make it a bit of fun. Yeah. We put out every season, we put out our seasonal tips. So at the moment, we're just about to put up our summer skin tips, and I've had the spring ones up for the last 3 months. So people can go to our website and just to get a bit of an idea how quickly they can change up their routine just to make life a bit better for themselves for that particular season. We know that winter's bad and we know that spring's bad, but for many people, summer's very bad too because of the heat. Heat makes you sweat makes you really itchy. So different times of the year, you need to change up your routine. Not just get complacent and say, no, I've tried everything, I'm not trying anything new. That's actually the wrong information. So pharmacists that give out lots of samples get a big tick in my book because we want people to try different products. There's hundreds of products out there and there's going to be something that suits your skin. You just have to find it.
Excellent. So the number one question that I ask folks, if you could teach everybody in Australian community pharmacy just one thing, what would it be?
Explain how to use topical steroids correctly and give some background information on moisturising and cleansing.
Okay, excellent. Well, Cheryl, I'm not going to take any more of your time. Thank you so much. I look forward to reading that book.
And we also developed an eczema care plan, which I'm going to flip you a copy of that too.
Oh, great. I'll put a link in the training.
Yeah. Lovely to meet you.
Yeah, you too, Cheryl.
Yeah, have a great day and have a great Christmas.
Cheers. Thanks, mate.
Keep safe.
Bye-bye.
Bye.